Hello, this is my sports med practical unit video for the hip, and we are going to start with the pathologies, then move on to the muscles, then move on to the special test. So here we go, and we're going to start off with the pathologies. Okay, we are now moving on to pathologies, and the first pathology we're going to talk about is the iliac crest contusion. So an iliac crest contusion is more commonly known as like a hip pointer, and so it normally occurs when there has been like a direct blow to the iliac crest. It can happen with like hard falls on the hip or just like trauma, and it can lead to like a lot of bruising, hematoma formation in like the affected area. So direct trauma is normally the most common cause, and it's just a direct impact to the iliac crest, often in contact sports like football, hockey, rugby, things like that. Next is like a crushing injury, and it's like it can result from falls, collisions, anywhere like the body weight just compresses on the iliac area, like on a hard surface. And then lastly would be sports activities, like athletes normally get them during activities where they're tackling or falling or having sudden movements, things like that. So that's the iliac crest contusion. Okay, so the second contusion for our pathologies is going to be a quadriceps contusion, and there is no special test for this. A quadriceps contusion typically results from a direct blow to the anterior thigh, often occurring during like contact sports. So a lot of athletes have problems with this, but also just activities. It doesn't have to be an athlete. The trauma can lead to muscle damage, tearing of the muscle fibers, like bleeding within the muscle tissue, and some mechanisms of injuries. One would be a direct blow, just straight to the quadricep muscle, commonly for a blunt object like another player's knee or a helmet for football or something like that. Something else is just like contact sports in general. So like football, rugby, soccer, just like anything where a collision would be very frequent and often. A forceful impact, muscle damage, inadequate protection if you don't have the right gear on, or like pads for football or something like that. Shin guards, like you get it. So anything like that. So just not having good protection, muscle damage, just allowing blood to like infiltrate the muscle and the tissues and just like causing pain and like restricted movement. So and this is the quadriceps contusion. Okay, the next pathology we are going to talk about is the heterotropic ossification. This pathology does not have any special tests, so there's no special test, but it occurs when bone tissue forms in like soft tissues and like in other places. So it often follows like trauma or surgery, but the mechanism of injury typically involves factors such as like soft tissue trauma, immobilization, pain, swelling, neurological insults, inflammation, and it can disrupt normal healing processes and lead to abnormal bone formation. They can show up on x-ray results between 2 to 6 weeks, and then so this is also known as like HO, and heterotropic kind of means out of place, and then ossifications means like bone, or ossificans means bone formation. So it's basically just like when the bone formation is out of place, and there's no special test. Okay, our next pathology is going to be the sacrum and coccyx contusion. Once again, because it's a contusion, there's no special tests, But yeah, so a contusion to the sacrum and the coccyx results from a direct impact of or trauma to the area. The mechanism of injury could be a few different things. So starting with a direct trauma, it's commonly known as a direct blow to the sacral or coccygeal region. It occurs during falls, landing on your butt, a collision in contact sports, things like that. The second one could be falls, falling backwards onto a hard surface. If you're like ice skating, falling on your butt, roller skating, something like that. Just like bruising and injury to sacrum and the coccyx. Next would be prolonged sitting, extended periods of times where you're just sitting on hard surfaces. It's going to be really uncomfortable. And like potential contusion. Next would be sports injuries, and then trauma from activities. Lots of athletes that like involves falls, or like when you fail, don't do the skill, you fall, like gymnasts. It could happen in football, wrestling, just they're at higher risk for sustaining contusions in the area. Yeah, and then this injury can result in pain, swelling, tenderness in the affected area, and it will probably limit your mobility, range of motion, activities, and just like sitting, bending, like simple things like that. And this is the sacrum and coccyx contusion. Okay, so the next pathology is going to be hamstring strains, and they are a very, very, very common injury that can occur when a hamstring muscle located at the back of your thigh gets overstretched or torn. The mechanism of injury for a hamstring strain can involve a million different things, but a lot of the things most likely are sudden acceleration or deceleration. So when you're going super, like if you're running super fast and then you just like immediately stop, like that's gonna hurt it. That can do stuff to it. So sprinting, stopping quickly, anything when your knee's extended and your hip is flexed is basically might cause it for something to happen. A lot of high intensity activities, football, soccer, basketball, all things like that. Muscle fatigue can have problems on it. Fatigue can lead to decreased muscle control and strength, making the hamstrings more susceptible to injury, especially during like high intensity activities and workouts. So yeah, poor flexibility can really take a rough on it, or not like stretching enough. I've pulled my hamstring before and I did not stretch before a game, and I thought that I would be fine. I thought I was warmed up enough, and then ended up pulling my hamstring and straining it. So you just need to make sure that you're stretching before things, improper technique, previous injuries, all things like that can just have it. But overall, the hamstring strains are typically the result of a combination of all of these factors that just all happen at once. They can vary in severity from mild strains to complete tears, which are like grade 1 to grade 3. Okay, our next pathology is going to be the femoral acetabular impingement, and the special test that you could use, there's two. You can do the hip scouring test or the anterior impingement test, yeah, so this is also commonly known as FAI, and it is a condition characterized by abnormal contact between the femoral head and the acetabulum, which is the socket of the hip joint, and so it can lead to pain or joint damage, basically. A few of the mechanisms of injuries, one is an anatomical abnormalities. So an FAI is often associated with structural abnormalities and in the hip joint. And so there are two main types. There's the cam impingement, which occurs when the femoral head is not perfectly rounded and it has an abnormal shape. and it leads to increased contact with the acetabulum during hip movement. And the second type is the pincer impingement, and it occurs when the acetabulum is overly deep or has excessive coverage over the femoral head, which can lead to the pinching of the labrum and cartilage during hip flexion. So a few other MOIs are just repetitive motion, just running, cycling, certain sports, just like over and over and over, can cause it to kind of wear and tear on the joint structures. Acute trauma, factors, age and activity level. It's just in sports that require like a wide range of motion, there's more likely for it to happen. And muscle imbalances, weakness or tightness in the hip muscles, particularly the hip flexors, abductors, and external rotators, can contribute to just the hip mechanisms and can increase your risk for impingement. So an FAI can lead to pain, limited range of motion. If it is untreated, it can result in labral tears or cartilage damage, potentially leading to just worse things over time. And so the earlier diagnosis and management are super, super important to prevent any further damage to the joint. So yeah, and this is the femoral acetabular impingement. Okay, our next pathology is going to be a labrum tear, and the special test used for this pathology is going to be the hip scouring test. Now, a labrum tear in the hip occurs when the labrum, which is a ring of cartilage that surrounds the acetabulum, is damaged. Now, the mechanism of injury for a hip labrum tear can involve several different factors. One is just trauma, direct impact, hip dislocation, falling onto your hip a direct blow to the hip joint can cause a labral tear. It's common in contact sports or during accidents. Hip dislocation and acute dislocation of the hip joint can lead to significant stress on the labrum, resulting in a tear. The femoral acetabular impingement, FAI, both of those can just lead to that. Repetitive motion, being active, being an athlete, athletic, dancing, soccer, running, like repetitive hip movements that are just going over and over can just wear and tear on the labrum, and over time results in a tear. Now, there's a few other ones like degenerative changes, muscle imbalances and weakness, and previous injuries that can all lead to these. There are many different mechanisms of injuries, but hip labral tears can result from a combination of them, and just so symptoms often include pain in the hip or the groin, a feeling of instability, clicking or locking sensations, limited range of motion. Early diagnosis and appropriate treatment are essential to manage these symptoms and prevent further joint damage. So yeah, and this is the labrum tear. So, last but not least, is the piriformis syndrome. Now, the special test that we are going to use for the piriformis syndrome is going to be the piriformis test. Now, it is a condition characterized by pain in the buttocks or the hip, often caused by irritation or compression of the sacrotic nerve by the piriformis muscle. Now, the mechanism of injury of piriformis syndrome can involve many different things, a few being muscle overuse, certain repetitive activities in sports, soccer, dancing, things like that, where you're just like doing the same things over and over can lead to it, trauma or injury, prolonged sitting for periods of times, nerve anatomy, anatomical variations, muscle imbalances, postural issues, and just other conditions can really have problems with this. So piriformis syndrome is often the result of a combination of factors, including muscle overuse, trauma, prolonged sitting, all the things that I just said. And symptoms typically include pain in the butt, that kind of go down your leg, numbness, tingling, sharp pains, and treatment often involves physical therapy, stretching, strengthening exercises, and in some cases, medication or injections to relieve the inflammation or pain. And this is piriformis syndrome. Hi, we are now going to move on to the muscle groups and the AOIs for them. So we are going to start with the glute group. So this is the gluteus maximus. We are going to extend, laterally rotate, abduct, and adduct the hip. The O is going to be the coccyx, edge of sacrum, posterior iliac crest, sacrotuberous, and the sacroiliac ligaments. And then the I is going to be the iliotibial tract and gluteal tuberosity. Okay, now we are going to do the gluteus minimus, and the A is going to be to abduct, medially rotate, and flex the hip. The O is going to be the gluteal surface of the ilium between the anterior and interior gluteal lines, and the I is going to be the anterior aspect of the greater trochanter. Okay, and last in our glute group is going to be the gluteus medius. We are going to abduct, flex, medially rotate, extend, and laterally rotate the hip. The O is going to be the gluteal surface of ilium between posterior and anterior gluteal lines just below the iliac crest. And the I is going to be the lateral aspect of the greater trochanter. Okay, we are now moving into the adductor group, and this is the adductor magus, and we are going the A is going to be adduct, medially rotate, extend, and assist to flex the hip. The O is going to be inferior ramus of the pubis, ramus of ischium, and ischial tuberosity, and the I is going to be medial lip of linea aspera and the adductor tubercle. Okay, second in our adductor category for the muscles is going to be adductor brevis. The A is going to be adduct, medially rotate, and assist to flex the hip. The O is going to be the inferior ramus of the pubis, and the I is going to be the pectineal line and medial lip of linea aspera. Okay, lastly, in our adductor or adduct category for the muscles is going to be the adduct longus. So the A is going to be adduct, medially rotate, and assist to flex the hip. The O is going to be the pubic tubercle, and the I is going to be the medial lip of linea aspera. Okay, so now we are on to our last category in the muscle groups, and they're kind of just like three random muscles, but the first one we're going to start with is the iliacus. The A is going to be flex, laterally rotate, flex the trunk toward the thigh, and to tilt the pelvis anteriorly. The O is the iliac fossa, and the I is the lesser trochanter. Okay, next up in the muscle group is going to be the piriformis. The A is going to be laterally rotate the hip, abduct the hip when the hip is flexed, and only when the hip is flexed. The O is going to be the anterior surface of the sacrum, and the I is going to be the superior aspect of the greater trochanter. Okay, so lastly in our muscle category is the psoas major, is how I think you say it. The A is going to be to flex the hip, laterally rotate the hip, tilt the pelvis anteriorly, flex the trunk toward the thigh, and to assist to laterally flex the lumbar spine. The O is going to be body's and transverse process of the lumbar vertebrae, and the I is going to be the lesser trochanter. Hi, I'm going to be performing the heel contralateral maneuver, and this is for the piriformis syndrome. So I'm going to be telling my patient what to do. So if this is the hip that's hurting, they're going to flex their hip and their knee. In the opposite leg, they're going to flex their knee and hip and fold it over, and they're going to grab under their thigh and pull towards themselves. This is going to stretch the hip that is hurting. They should feel a positive test would be numbness, tingling, pain, all on the posterior side of their head. Hi, I am performing the piriformis test, and it's for the pathology of the piriformis syndrome. We are going to, if this is the hip that's hurting, we're going to pick up this leg. We are going to flex both the hip and the knee, and we are going to internally rotate the hip and the knee, adduct the foot, and push in. Now I'm going to ask my patient, where is the pain?
It's right here.
It's on the under.
Yeah.
So if there's numbness and tingling, it's going to be a positive test for the piriformis, and if the pain is in the front, it's going to be for the FAI. This is the anterior impingement test, and the pathology we're using for is the femoral acetabular impingement. We are going to, if this is the hip that's hurting, we're going to lift up this leg, and we're going to put the hip in flexion, the knee in internal rotation, and we're going to adduct the foot, and this is basically just a test. They're going to feel a lot of pain right here. Right here.
Ah!
And they're going to be screaming, and it's going to be on the lateral aspect of their hip. Hi, I'm going to be performing the scouring hip test. That it's for the pathology of a labrum cartilage tear, and I'm going to have my patient laying supine. I'm going to get on the table so I can do a better job. I'm going to put her foot under my armpit to have a good stable position. I'm going to have my knees pushing down on her femur. I want the ball to be rubbing, and I'm going to be turning, twisting, moving in circles, going side to side, up and down. And a indicated positive test would be pain anywhere along the hip, and that the pain just continues to come.